Nobody expects to have a child that is not perfect. So the twins were born 8 weeks premature. They were both healthy, everything was fine. We brought them home at 5 weeks, and from the beginning, Matthew was just a little more sensitive to things. If we held him too much, we wouldn't be able to hold him the next day. And then probably at about 6 months, we just saw that he wasn't progressing the same. He didn't have the same ability to hold up his head and to hold his body like Christopher did. And then at 2 years old, when they did an MRI, that's when they diagnosed him with cerebral palsy.
You take this journey, you have 2 little babies, and as parents, you're just happy that they're alive and well and breathing on their own and all these things. We didn't know what to expect. We didn't know what it meant for both Matthew and ourselves and the family as a whole.
The fact that he has a twin brother, that's the biggest blessing. Chris, who's able-bodied, didn't walk till he was 18 months old. Not that he couldn't, he was waiting for Matthew. Eventually he had to start walking, but what that did for Matthew is it gave him an idea of what he wanted to do.
Each of them would fill a certain need to one another, and Christopher had the legs and the ability to reach up and grab things off the shelf, given to Matthew, where Matthew had the ability to figure it out.
Early on, when we got the diagnosis, we kind of looked at all the possibilities of roads that we might go down. So hip displacement is common for kids with CP. One of the things to combat that is something called a selective dorsal rhizotomy, which is neurosurgery. The neurosurgeon selectively cuts bundles of nerves in the spinal cord that go to that area where those muscles are firing. And that was a really hard decision to make.
What are you getting done today?
Having my food
And what is it for?
to help so my leg don't so stiff.
Make your legs not so stiff?
With this surgery comes a very intense rehabilitation program. The transition from Children's Hospital, where the surgery was done, to Sunny Hill was seamless. They were prepared for us. They knew Matthew was coming.
When you have a child that needs help or medical assistance or rehab, that there's places like this that we can take our children, we are so lucky, because our life would be very different without them.
They helped us understand what we were up against. They helped us to understand what to expect and also how to get there.
It was really collaborative. We had team meetings every week, and they really took their direction from us, which was really nice to see. So for Matthew, our focus was to have him up and progressing to walking. He's probably the most inspiring person I know. He will always try, even when something's hard, even when it hurts, even when he doesn't want to do it, he'll always try.